Hello, listener, and welcome to the Southern Seven podcast. I do hope this isn't your first time joining us, but if it is, I'm Shauna Ryan, Community Outreach Coordinator for Southern Seven Health Department and Head Start. The Southern Seven podcast is a service provided by Southern Seven Health Department to help you and your family live better and stay healthy, and is recorded at our central office in Olin, Illinois. Southern Seven serves the lower 7 counties of Illinois with public health clinics and Head Start centers in each of the counties we serve. If you like today's episode, please share it with a friend. And if you haven't done so, make sure to check out our other podcasts on the Southern 7 app, on Spotify, and through our website at southern7.org. Well, listener, in June of 2024, Southern 7 Health Department joined with the Illinois Department of Public Health, also known as IDPH, in recognizing gun violence as a public health crisis and to promote community gun safety and prevent accidental injuries in Southern Illinois. And this was done by giving out free gun locks to residents that requested them. Well, as of September 30th of 2024, about 2,000 individuals have been reached and more than 600 gun locks have been distributed. Now, we plan to continue this program through June of 2025. So we wanted to take this opportunity to share with you what has been done and what the plans are for the future. So in this episode of the Southern 7 podcast, we're going to be talking with Allie Baum with the Ad Council and Colleen Creighton with Brady United Against Gun Violence and their partnership in this effort, and what these groups are doing to reduce gun violence nationwide, and what you can do to ensure that your family stays safe if you are a gun owner and have firearms in your home. Now, I want to make perfectly clear that we are not talking about gun control, just overall gun safety. So let's get started with today's episode, Gun Safety in the Home.
Southern 7 Health Department and Head Start, making a difference in your community, one family at a time.
When you think about Southern 7 Health Department, what comes to mind? Is it flu and COVID shots? WIC? Restaurant inspections, health education, cancer prevention, or Head Start? Yep, we do all that. But did you know there are more than 50 programs and services offered through Southern 7, all designed to keep you and your family healthy and safe? And that doesn't include our Medical Reserve Corps volunteers who are ready for you in times of disaster. Southern 7 offers so much, we simply can't mention it all in 60 seconds. So what we want you to do to learn more is simply download the Southern 7 app to take you directly to our website. There you'll hear the Southern 7 podcast, connect you with our social media pages, and let you call the Southern 7 Public Health Clinic or Head Start site near you. Well, that's it. My time is up.
634-2297.
Hello, listener, and welcome back to the Southern 7 podcast. Well, we have a surprise for you today. We have a couple of ladies who are not associated at all as far as staff at Southern 7 Health Department. These ladies are outside of our organization, and we are so thrilled to have them here to talk with us about gun safety and what you can do to keep you and your family safe at home. And first, I'm just going to say their name and let them introduce themselves, and then we'll get started. So, Allie, tell us who you are and where you're from.
Hi, everyone. First of all, thanks so much for having us today. I am Allie Baum with the Ad Council. I'm a vice president. I've been at the Ad Council for going on 13 years now, worked on many social issues in my time. Most recently, lots of work with the Brady team and Illinois Department of Public Health, among many others, on gun violence prevention, particularly secure firearm storage and extreme risk law education.
Wonderful. Well, Allie, thank you so much for being with us. And Colleen?
Hi, and I echo Allie's statement. Thank you so much. We're excited about the podcast that's coming up. And my name is Colleen Creighton. I'm Senior Director of End Family Fire for Brady, and we'll get into a little bit more about what End Family Fire is. But I come to the space from childhood injury and suicide prevention.
Okay, very good, ladies. And folks, if you're wondering why we're doing this, if you got lost in the first part of our intro here, basically, we are doing a gun safety program here at Southern 7 Health Department. These ladies are a partner in that effort, as well as the Illinois Department of Public Health. So we are so grateful, ladies, to have you with us today and to talk with us about what's going on and to help people in keeping their families safe. So let's just go ahead and just dive right in. And how would you, first off, when we talk about gun safety and gun violence, how would you describe the term gun violence? What is that? What does that mean to you?
Sure, Allie, if you want, I can jump in and then we can tag team. But really, it's kind of a broad term that means any injury or death resulting from a firearm being improperly misused. And so, you're causing harm to yourself or harm to someone else. So, a lot of times, unfortunately, this happens when someone that should not have had access to that firearm gets access. It wasn't safely stored or securely stored. And so we'll get in a little bit about our campaign and what we're doing, but a lot of gun violence is preventable with the simple act of just keeping guns safely and securely stored.
Exactly. Allie, would you like to add to that?
Yeah, I would just build on what Colleen is saying, which is gun violence itself is a very broad term to refer to many different types of injuries and deaths. And that means there are many different and important solutions and groups that are working together to address this crisis in our country. One of the things that Colleen and I at Brady and Ad Council have been doing together is bringing that from Brady's perspective, Colleen as the nation's oldest gun violence prevention group, an ad council from a marketing and communications and public service and public education campaign creator, are really working to tackle the awareness and attitudinal and behavioral changes for certain subsets of gun violence. So specifically, Colleen is talking about firearms from the home that are misused because they're improperly stored, or someone shouldn't have access to them because they're displaying signs that they intend to harm themselves or someone else. Those are actions that can clearly be prevented through ensuring that access isn't there, whether that's through storage or through other tools. So a lot of our work is really around creating campaigns that educate on the importance of secure storage, or that raise awareness of extreme risk laws in the states that have them, to ensure that that message is out there and it's really research-based and reaching the target an audience whose attitudes and behaviors we're working to influence to save lives and keep communities safe. And Colleen, do you want to talk a little bit about End Family Fire specifically?
Yeah, and I want to talk this exactly what Allie was saying is a lot of times they hear the term and people think it's a divisive issue, right? And it kind of divides, but it's not the case at all. When Brady about 8 years ago started looking at, we're in an epidemic, we see that the number of lives lost each and every day to firearms. What's a good way that we can come at that from different angles, but start making an impact and start saving lives? And one of the things we first did was, who's a leading expert on this? That would be the Ad Council. They do public education campaigns. They are the nation's leader in knowing what resonates with the public. And so we all came together and we said, how can we tackle this? And the first thing that came out of that was give it a term, right? If you give it a name, then you can wrap a strategy around it. So we came up with the term family fire, which is a play off friendly fire, but it's also, an injury or death resulting from accessing a not securely stored gun. And you'll see me stumble a little bit. We're changing from safe to secure. We're following latest research showing, that's where the industry is moving. So I'm going to use both interchangeably, and because that's where we are now. But so someone getting access to that gun within the home. And when we looked at that, what does that mean? And Allie talked a little bit about that. It's unintentional injuries, right? So kids are getting into a gun, they're finding it, they're curious, they're finding something that wasn't in securely stored, meaning we lose 8 children a day to finding a gun within. If you look, that's one area. If you look at the second, it's suicide. And a lot of individuals don't understand that the majority of gun deaths are actually suicides, well more than half. And so, we have a whole end of the campaign that does that. And then the third one is really misuse across the, and we'll talk a little bit about specifics, but school shootings. 76% of school shooters get their gun from the home. And, domestic violence is another issue that comes under there. Homicides in general, and across every other spectrum. So kind of that's a lot to digest, right? All these different areas of firearm violence kind of bubbles up into, this is family fire. And our goal for the program is to end family fire. So that's kind of the nexus that went into the campaign. And what we're doing, we can get into this a little bit more too, is working with Ad Council to get that preventative message out to more communities. And we'll talk into, it's not just us, saying this is going to work. The campaign, each one of the campaigns goes through like a year, 12 to 18 months of research, right? Everything from lit searches, seeing what's out there, consumer testing, focus groups, right? Our own research saying what resonates well with the target audience. Gun owners are included throughout that entire process. So when we talk about ending family fire, it's not just this national or a couple of national groups talking from the top on down and telling the communities. We're actually threading throughout the communities and saying, as a gun owner, this impacts you. We need your voice to ensure that this campaign is going to be as effective as possible.
Well, where we live here in Southern Illinois, there are a lot of gun owners, whether they be for hunting or just for their own personal, activity. And so, in the past, it's always been if you start talking about gun safety, that in their minds, they're thinking, okay, I got to get rid of my guns. I got to do this, that, and the other. I don't want to store my guns. So, but how can I get to them quickly if I need to get to them? So you guys are kind of shifting that narrative away from, look, we're not trying to do anything to where we're taking guns or we're trying to make it, you know, less easier for you to have access to your own personal guns. We're just trying to talk to you about being safe in the home, which, studies do show that the majority of gun owners do believe in firearm safety. They do believe in background checks and keeping their family safe and keeping everyone else safe. So this is just an extension of that, right? Just, going into just that next level of education for folks right here.
It is, because I think if you talk to gun owners, there's a wide variation in all sorts of safe storage and secure storage and what that means, right? We have everything from cable locks, we have everything from trigger locks, we have everything from safes and boxes to larger safes to biometrics, right? And what we found is there's not one prescriptive measure for one type that will work across the board. Everyone's going to have their own, ability to purchase. Everyone's going to have their own ability to something that works within their home, right? There's a lot of new creative ways coming out. So like we said, it's a continuum. So we know you practice safe storage. We know you're good gun owners. We just want you to take that extra step and ensure that you're keeping your family safe. Because a lot of times too, which, a new baby comes into the home and you forget, right? And you're distracted and the gun may be lying around. You have visitors coming over to your house. There's also a day in June it's June 21st, first day of summer. It's Ask Day, which is Asking Saves Kids. And what the campaign's trying to do there, and Brady, that's one of our campaigns. It started about 20 years ago. And it's really normalizing the conversation. You ask about allergies, you ask about pets, swimming pools protected, but did you ask if there's an unsecured gun in the home? So we're also working with them on that. You may forget, you have kids coming over and playing, your kid is going over for a play date. And then along the same, you may have an elderly relative with dementia, right? Or some other thing so we're asking them too, it's not just a one and done. You're going to have life changes and stages throughout, your own life and your own home. So it's just continually remembering that, saving, just even keeping that gun safely secured can save a life.
Exactly. Allie, do you have anything to add to that point?
Yeah, I think that's it. Thank you so much for that, Colleen. And just to build on what you were saying too, Shauna, I think that what we hear from all of our conversations with gun owners throughout this work, it's all about responsibility. And that is a common theme. And gun owners want to be responsible gun owners, and secure storage is a piece of that conversation. So our job is really to pull on that thread, to use campaigns to illuminate the barriers, and then really, dig into how do we, to use a sort of advertising speaker, how do you flip the script? How do you get someone to rethink their behavior? And again, moving along that continuum. But everything, I think this is really important, especially when you're talking about an issue as broad as gun violence, is non-political, it's nonpartisan. We're not about passing any legislation. It's a very simple preventative steps to keep you and your family and your community safe. So that's a really important and a differentiating thread for this program, as opposed to other programs out there, is that firm belief in the nonpartisan, non-political common ground component to these solutions.
Yes, and we all know, we've heard it quite a bit. It crosses all party lines. It has
Right.
nothing, this particular issue, in my opinion, really has doesn't have a whole lot to do with political affiliation. This is a safety issue. Illinois Department of Public Health is involved in it because it's a public health issue, and that's how we need to see it. And I'm so glad to hear that is what is taking place.
Because, and I want to jump, one of the things we're doing is shifting the narrative from the gun itself, keep the gun safely stored, but the campaign is about saving lives, right?
Exactly.
So that's our entire goal across, whether you own a gun, whether you don't own a gun, whether you know friends with guns, we need everybody to encourage gun owners to securely store their guns too.
Exactly. And you can still have access to them. So it's, as the gun owner yourself. Now, one of the things that we talk about quite a bit when we talk about gun violence and storage and so on, is we talk about firearm restraining orders, or FROs. And these are also known as extreme risk laws or red flag laws in Illinois. And, kind of elaborate a little bit on FROs and what they are, who can put those in place, how does that affect what you're trying to do here?
Sure, and I can jump in first too. FRO is a firearm restraining order, right? And unfortunately, each state, there's 22 states that have it in DC, but each state also calls it different things. So I know you mentioned red flag laws. We're moving away from that term. The mental health community is a little resistant to that.
Okay.
GVRO, gun violence restraining orders in California, right? Delaware has different, so each of the states has their own term for it. So that's why I want to be very cautious, and we'll talk a little bit about that.
Sure.
But who can be a petitioner? This is something for, this is not something against a gun owner. This is for a gun owner. And
Right.
what the campaign is about, it's if you know somebody is in crisis, either in harming themselves or in harming someone else, it's a way to get them help so that they can heal. And you'll see in partnering with the Illinois Department of Public Health, and as we started with this campaign, as we started doing research, as we started testing it, we realized that, like we said, everybody just needs that pause. In a moment of crisis, we see the stats for suicide. If someone's going to take their own life, if they use a firearm, 90% of the time that's going to be lethal. They're not going to get that second chance of life. An FRO gives them a second shot to save their life, right? It may be a moment of crisis. They have access to the gun. They're going to attempt to take their life. In a moment of crisis, if someone has intercepted and started the process, the petitioning and getting that gun away from that individual at that moment, they get a second shot to live. And so the campaign is a great one. Again, it's just like our End Family Fire campaign. It's about saving lives.
Okay. And listener, we want everybody to realize that while we're talking about FROs here in this conversation, healthcare providers and Southern Seven Health Department is a healthcare provider. We're not able to petition someone for an FRO. All we can do is just share the information with you and encourage you to take steps to keep you and your family safe and to make sure you have that information. That's why we're talking today. So I don't want anybody to think that as we are out sharing the gun locks and talking to people about this, we're not turning people in or trying to do anything like that. Correct? Yes.
No, and it's mostly family, in Illinois, it's mostly family and police officers. But this is the great part about partnering with the Illinois Department of Public Health is we have a whole page for that and a campaign for that. So it's if you go to illinois.gov/pause to heal, you'll find all the information specifically to Illinois. Like, what do I need to do if I'm who do I turn to? What's the process? And then we also find out there's a lot of misperception out there. So that page also clears up, here's fact, and here's what you're doing, and here's how you can help the problem and the person that you love.
Very good. All right. Thank you so much. Okay. So looking at firearm statistics, give us some nationwide numbers. What are we seeing in terms of homes with unlocked and loaded guns, suicide rates? What are we seeing nationwide?
I would say that there are a couple of statistics that really show the scope of the problem, specifically when we're thinking about those family fire incidents. So like Colleen was talking about, unintentional shootings, some intentional shootings, and firearm suicides, really those tragedies that are a result of someone having access to a firearm when they shouldn't have it. There are a couple of really key stats that are shocking and sort of demonstrate the scope of this issue. One is that 4.6 million children live in homes with unlocked and loaded guns. We know that access to a gun triples the risk of a death by suicide, like Colleen was mentioning earlier. And in around 76% of incidents, the firearm that was used in a school shooting was obtained from the student's home or that of a friend or relative. So really just underscoring again that challenge of access. This isn't about whether or not there is a firearm around. It's about ensuring someone doesn't have that access when they shouldn't have that, whether they're a child or they're displaying those signs, they intend to harm themselves or someone else. And that ties back to the End Family Fire campaign, the Pause to Heal initiative that we're working on, really highlighting two of many solutions for how do we address that issue of access in those key moments. Secure storage, extreme risk laws, collaborating with local organizations to really highlight these tools. That's all a key piece of it. But I think really thinking about those numbers illustrates the scope of this challenge and really also highlights, importantly, those very clear solutions to help address this overarching problem.
Exactly. And those numbers are staggering in terms of what we're seeing, especially when you're talking about school shootings and or mass shootings, how the majority of those guns are gotten inside the home, which I think we knew a lot of that, but the numbers and the percentages of that is just amazing. Do we happen to know what the Illinois statistics are, or is there any way we can share that information where people can go and get that on their own?
This is a really timely question. I think just 2 days ago, the Illinois Department of Public Health announced the launch of a new data dashboard on violent deaths and firearm injuries in the state. So listeners can search for that. And I was playing around a little bit with the data. There's a lot of really detailed information out there down to the county level in Illinois. About firearm related incidents, including the type of incident, whether that's a homicide or a suicide, the weapon, where victims were, and it's all broken down again at the county level there. And I think this kind of information being available really underscores how we can collectively work on data-driven prevention and intervention efforts to reduce these tragedies. There's really, it's very useful to see this all. And I think if I'm remembering correctly from some of the information I read about this is really the first of its kind and maybe the third in the country of these state specific dashboards that exist to this scope. So real kudos to the Illinois Department of Public Health for spearheading this project and their leadership there, because having that information really helps us understand where do we need to dig in? How do we, from a public education standpoint, deliver the right message, but also how do we ensure that we're collaborating with the organizations on the ground to really make meaningful impact on this work.
Yeah.
There also are some key, I think, Illinois statistics that are highlighted within the dashboard. Just looking through some of them, one that really stuck out for me was that men are far more likely to be victims of violent deaths and non-fatal firearm injuries, accounting for 89% of all of the deaths since 2015 in Illinois. So as we think about those who are most likely to be affected. And then additionally, firearm violence, as we all know, disproportionately affects communities of color. And that's really important for us to think about when we think about messaging for the campaign, solutions, and how do we ensure our work and the work of those, everyone in the community is reaching those who most need to hear this message.
Okay. And Allie, do you have that web address handy? If not, I can get it and put it in our
I
file.
do not, but I will.
I can get that. It's
I
okay.
can
I can get that. So listener, we'll make sure that you have that information following the end of our podcast here. Colleen, did you have anything to add?
No, what I was going to say from kind of the national scope, there's often a delay in getting national statistics, as they get compiled up and then analyzed. So what's so exciting about really having the states take a lead on this is you're able to also see kind of things that are popping up around the country, and you're able to address it at a much quicker rate. And I'm speaking kind of with my suicide prevention hat on, but we were able to see, like, here's something happening and like, keep an eye on it. There's an issue that we're seeing, oh, next door too. And you're able to work with the community itself to really impact like a strategy to get at it, rather than waiting a year later when you're like, now I know there was an incident there, and by then it's too late. So like Allie said, kudos to the department, because this is really exciting on so many different levels.
Well, it's my hope that with IDPH coming on board, that families acknowledge this as a health issue and are starting to see it as that, not just, again, gun control and whatever there, but seeing that this is actual something that impacts all of us, not just maybe a subset of us. It impacts us all. Now, what are your next, I'm sorry, I'm skipping ahead just a bit. Let me retrack here. Okay, now in looking at the In Family Fire campaign, it's a wonderful idea. How is it working in practice? What are, as far as, how is it impacting what's actually happening in the state?
It's an amazing campaign. No, it's like, but I mean, at
Sure,
Brady,
yeah.
obviously we measure everything thoroughly. Everything we do is metric or data driven, and it's a continuous tracking. So what we do is kind of use a funnel approach, right? And we're measuring for four major items. We're exposure. Are they seeing our ads and campaigns or PSAs, right? We're doing this across the board. Awareness. Are they aware, and are they aware of the dangers of a gun? Those who have seen our campaign, those haven't. So we have that baseline going as well. Are they engaging with the campaign, right? And the fourth one is, are we having impact? So there's a couple of different ways that we look. It's, have you seen our ads? Are you aware of the issue? Are you talking to a friend or family about the issue? And then, are you planning to store your guns differently in change in behavior? So it's perception, awareness, and behavior across the board. Monthly, we're looking at those so that if something pops up, like I mentioned earlier, we can actually alter or course correct as needed to make sure that we're having ultimate impact. On the back end, and then we do wrap up quarterly. We all take in the team. It's the entire ad council team, Brady, our End Family Fire campaign, but also from a lot of different lenses as well. We take a look at that. We take a look at it annually. And if you see some of the numbers, 60% of gun owners are now aware of our campaign, right? And so the cool part about working with Ad Council and getting this out there is because of Ad Council's name and brand and visibility, we're able to get key placements, right? And like major sports things on TV, like NFL games. All of a sudden, someone will call us and say, "Hey, I saw an EFF ad. This is going on here." We're seeing billboards. So we just placed a billboard for the Warriors Stadium out in California. They said, we want to tackle this issue. So the scope and scale of it is getting out there. 60% of the gun owners have seen our ads. Then, once they've seen the ad, they're 4 times more likely to have sought out more information on safe storage. What does that mean? Where can I buy it? What is the safe? What's a trigger lock? And then 3 times more likely to have talked with a family or friend about the issue. So, I'm concerned. I need to take action.
So do you partner with any local retailers on that might sell guns within their establishments? Do you partner with them and have information available for buyers, and is there anything like that in our region?
Not yet. In other areas we have, right? In
Okay.
Texas, we worked with one of our campaign members. He was suicidal. He tried to take his own life. Safe Storage now saves his life. So he worked with us on a campaign, and he took that campaign to a local gun shop. And he sat there and he talked to them, and actually they sold more safes, right? Because they were saying, this is no longer just a theoretical issue that something's happening to someone in some place. This is someone I met. This could be me. This could be my relative. This could be my next door neighbor. Like, it suddenly kind of brings it back home to, this is something I should pay attention to. So this is the part of the next stage of the campaign, which we can talk about. It's really, now that the ads are out there, we really want to drill down to the community level and start talking to those and saying, like, what do you need best? Because we know Illinois, what's going to work for one community is not going to work for the entire state. And it's really kind of drilling down and saying, locally, we're here, we're listening. How can we help? What's going to work best in your community?
Because I mean, I know we would love to help you get that word out. I mean, I'd love to see more billboards and more things around, and so we'd be happy to help you in any way to get that done. To get the
I love that. And the point of
there.
sale, if you're buying a gun, if you're buying a safe, if you're buying any kind of a storage device, we would love to have at least go visit this website, endfamilyfire.org or illinois.gov/pause to heal. Like, both are applicable. We just want them to have the information at the ready. Why couldn't you have an End Family Fire in the safe, so that when they get it, they can see that. So Yeah, taking all ideas. We would love, we're speaking from this campaign as well, but like we said with End Family Fire, all of Brady, like we have members around the country, and we have a lot of members based in Illinois. So
Okay,
let's do this.
very good. Okay, wonderful. Okay, so back to what I was going to ask. Okay. So what are your next steps in reaching gun owners? We just talked about a little bit of those there. Do you have any far-reaching goals, anything in particular that you're thinking about moving forward, especially when it comes to downstate Illinois? Do you have anything going on there?
I think it's exactly the strategy we all started talking about, which is Colleen talked about the results for this campaign. So nationally, we know this message resonates and this message has the power to change attitudes around secure storage and importantly, change those behaviors, get someone to rethink and take that next step to store their guns securely. So knowing that the platform resonates, knowing that that broad messaging, all of the research Colleen mentioned earlier, those year and a half before and then during and after all of our initiatives, that is really something that we are very proud of and very committed to. We also recognize that takes tremendous resources to do that. And our goal really is to continue at the national level to have this campaign, have you see it at Warrior Stadium, have someone see it on TV during a key game or just on a regular weekday night. That is a really important part of the strategy for that continued exposure, like Colleen was talking about. The other piece, though, is we know every organization on the ground is working tirelessly to address gun violence in their community. And we know that in many instances, these solutions, whether it be, like Colleen was saying, secure storage or extreme risk laws, are critical to that. So instead of each organization needing to start from the baseline, do the work, figure out the message, we would love to have those conversations and really work on the on the ground component to complement that broad national public education campaign that we have. Talk to you all, other colleagues of yours in Southern Illinois, and understand what's the need there and how can End Family Fire, how can Pause to Heal support that need. One of the things Colleen and I would like to joke that we really like to do is just brainstorm. Is it putting our ad, re-recording some language or thinking about some audio that can run when someone's on a hold line for a doctor's office, for example. That, like, we've talked about that. Is it a poster? All of this work has been done and it exists, and we want to share it. So a real goal for us in addition to thinking about, are there other audiences that need specific tailored messaging and content? It's how do we work with organizations to ensure that that trusted messenger in the community is getting this word out. So that's a really important cornerstone to our strategy and our expansion as we look to the next 6 months, year, and beyond.
And I think one conversation can change a life, right? Because I think a lot of times we're working with this one district in a different state where a school nurse said, this impacts me. I know it impacts my school, but I'm not part of the establishment. I'm not part of like a group doing on this work. It's just me, individually. There is a role for each individual person out there, right? We can give you the resources, reach out to us. We have it. We can do trainings, right? If you're comfortable, we can. So our goal, like Allie said, is that, be creative. Like, we love ideas, we're willing to work with each individual or community to really take like a theoretical concept and make it work in the state. So we're willing to take hospitals are another big one for us as well. Working with doctors and giving them, here's the tools, how to have the conversation with your patient. Here's what an ERPO, here's what an FRO is. Here's what safe storage or secure storage means. School nurses in the school teachers, parent, PTOs, like every person that you can imagine has a role to play with this issue.
Very much so. Well, ladies, we thank you so much for your time and talking with us. This is one of those conversations that we could probably talk about for hours. And hopefully at some point we can bring you guys back and do a little follow-up and find out how things are going, where this program is landing. Let's think about that sometime over the next year and do a follow-up with that. And folks, for anybody who's interested in getting a gun safety lock, You can contact us here at the department. We'll make sure we get one to you. You can also pick them up on our Wellness on Wheels van, which circulates throughout our region. But give us a call here at 634-2297. We want to make sure we get that into your hands. So we've got people here that are experts in getting that to you. I'll make sure that we get that over to them and make sure they get that as well. But ladies, for anybody who might not be from our region, who's listening to the podcast, where can they, where can they access gun locks and where can they access that information if they're not able to go to just to the regular department store or whatever? Is there a place that they can go online to request a gun lock to be mailed to them or anything of that nature?
We are working on that. That's one of the sticking issues across the country, that it's not universal, right? So it's not one department in every single state or community. Some of them is law enforcement, they have them. Some it's the public health department. Others, it's a hospital system that got a grant for a certain amount of time. So what we're doing with End Family Fire is we realize that's a gap that needs to be filled. And so we've been working with our organizing and state chapters to really start compiling that information. So we have, if you do have a question, reach out to me. We can direct you. We haven't publicized it yet because we're still populating it. But that you've just clearly identified a huge gap that we're all trying.
Sorry.
But no, but I mean, thank you for giving the locks out, because I think that's a key portion, is making it aware that there is someone out there. The other big one doing this too would be the veterans. The local VAs do have locks that they give out. So that's always a resource as well across the country, wherever you are, that you can get one.
Okay, very good. Very good. All right, ladies, is there anything else you'd like to add to our discussion today?
This has been incredibly wonderful conversation, and thank you so much for using your platform to really highlight this as a part of, again, the important work that many groups in Southern Illinois and beyond are doing to address this issue. It's not something that's going to be changed overnight. It's extremely complicated, but our goal really is to illuminate some of those easy solutions to prevent these preventable types of gun deaths. So we appreciate the opportunity. And Colleen mentioned the URL, but if you're interested in learning more, endfamilyfire.org for information about secure storage, and then illinois.gov/pause to heal is the go-to resource for firearm restraining order education materials in Illinois. For other states, there are national IRPO resources where you can look for more information, but definitely for extreme risk laws in particular, the state-specific information is very important. And anytime, please feel free to reach out to Colleen or me, and we're very happy to brainstorm with you, chat more, and think about really how we can support the work that all of the important organizations are doing around this issue.
Yes, and we here at the health department, we partner with roughly 50 different agencies throughout our region, and they are aware of the program and everything. So even if you can't get a hold of us for whatever reason, which you shouldn't have a problem, but if you can't, there are other organizations and agencies in Southern Illinois that you can reach out to, as well as other health departments, to get that information. So we'll make sure that you get what you need. Colleen, is there anything else you'd like to add?
No, I think Allie covered it, but I just wanted to say we're here for any questions, any, ideas. We're here to help. So just let us know how we can.
Okay, great. Well, ladies, thank you so much. We'd love to have you back on again. And thank you so much for the partnership that you have with us here at Southern 7, as well as with the Illinois Department of Public Health. We've been excited about this program since the start, and it's exciting to see that it continues to grow and do well. And most importantly is being accepted, and folks are very receptive to the information. So that's what we're working on here. So thank you again. Appreciate that. Listener, for you, if you're listening to us on through an audio platform, just so you know, you can visit us on our YouTube channel at Southern 7 Health Department, and all the links and all the information we've talked about today, we will have that on our YouTube channel. You can go ahead and access that. We'll make sure that you have all that information. All right, ladies, thanks again. We appreciate you joining us. And folks, for you who've listened to us, thank you so much. Make sure you check us out on all of our platforms here at Southern 7. You can check us out on Facebook, Instagram, wherever you get your news and information, we're probably going to be there. So make sure you check that out. But again, you can listen to this on our YouTube channel and download the Southern 7 app to hear all of our podcasts here at Southern 7 Health Department. So from all of us here at Southern 7, ladies, thank you again for everything else. From all of us here, have a wonderful day, folks. We will see you back here again another day.